So let's continue from this indigestion and difficulty in swallowing. So the persons at risk for gastric cancers and esophageal cancers, Helicobacter pylori infection, males over age 50, African American race, diet high in nitrates, tobacco abuse, history of Epstein-Barr viruses, that is for gastric cancer. And for esophageal cancer, tobacco or alcohol abuse over the age of 50, males, history of Barrett's esophagus or gastroesophageal reflux disease, obesity, caustic injury to esophagus. So this Barrett esophagus means it is a preliminary cancerous stage. That is the primary cancer stage of esophagus. That is mainly occurs at the lower portion of the esophagus after as a complication of liver cirrhosis and all this may occur. Okay. Now obvious changes in molds. So here small moles will be appearing our body. So in order to rule out this mole and its characters, we have to use ABCD rule. Asymmetry, does the mole look the same in all part or there are differences? Then border, are they border sharp or ragged if they are having border and all. Then color, what is the color of this mole? Then diameter, is the mole is bigger than a pencil eraser? Okay, so that things A, B, C, D, asymmetry, border, color as well as diameter. So this is purely the indication of skin cancer, this asymmetric mole or change in mole or what that one. So here the chances is for melanoma and skin cancer. So the persons are at greater risk include excessive ultraviolet light exposure, person with excessive ultraviolet light exposure, light skin tone, blue eyes, blonde or red hair, personal or family history of skin cancer, history of severe childhood sunburn or immunosuppression. These persons are at greater risk for melanoma as well as the skin cancers. Now, nagging cough. Nagging cough, any change in cough or voice hoarseness, change in voice, etc. And a cough that do not go away from the person. Then sputum with blood. Whenever coughing or without coughing, sputum in blood may occur. Persistent productive cough. This is the most frequently reported symptom of lung cancer. So this one is purely the indication of lung cancer. Hoarseness will be indicator of laryngeal cancer or any thyroid cancer, sometimes for lung cancer also. Okay. So in for lung cancer, the person at risk include person with tobacco abuse, exposure to asbestos, radon, or second-hand smoke, radiation treatment to lungs, personal or family history of lung cancer, etc. For head and neck cancer, the person at higher risk include tobacco or alcohol abuse, over age 50, males, history of Barrett esophagus or gastroesophageal reflux diseases, then obesity. These are at high risk for head and neck cancers. So this is just for your understanding symptoms and what's the action that must be taken. For a change in bowel or bladder habit, ultrasonography, endoscopy, a sore that does not heal, biopsy must be done. Unusual bleeding or unusual discharge, rectal examination, colonoscopy as well as gynec examination. Thickening or lump, we have to do for go for FNAC. Indigestion or difficulty swallowing, endoscopy must be done. Obvious changes in the size of mole or that must be go for biopsy. Nagging cough, we have to go for ENT examination and chest X-ray. Okay, this is the immediate action that must be taken whenever we are getting with or any kind of symptom, warning signs of cancer. This must be educated to everyone. Okay. Now let's move on to the secondary prevention. So in secondary prevention, it mainly include actions which halt or stop the progression of a disease at its incipient, that is starting stage, and it prevent the complication. So it basically include early diagnosis and treatment. It include early diagnosis and treatment. So before entering into the serious stages of a particular cancer, we are preventing the disease or we are limiting the disease progression. Okay, that is what is basically secondary prevention. So early diagnosis means screening test that for breast self examination, pap smear test, radiographic examination, testicular self examination, etc. And adequate treatment, appropriate treatment must be carried out. This includes secondary prevention. So basically what is explaining in secondary prevention means screening. Cancer screening must be carried out. So in case of cancer screening, the basic elements of cancer screening include review of past and present medical history, history of exposure to carcinogens in daily living, that is what kind of occupation the person is at, and what kind of materials is, or the substances is being exposed to the particular person, if they are having any other like lifestyle habits, etc. And detailed family history, that is any family hereditary disorders or any cancers that is running in their family, that must be done or evaluated primarily. This is the basic elements of cancer screening. So early diagnosis can be done by any one of the measures. So early diagnosis is very important, and that can be done through several studies like cytology study, tissue biopsy, chest X-ray, complete blood count, chemistry profile, LFT, some of the endoscopic examination, radiographic studies, radioisotope scans, PET scan, tumor markers, bone marrow examination, etc. So here in PET scan tumor markers, genetic markers, you have seen PSA, CA125, BRCA1, BRCA2. So these all are the indicative of some of the cancers. Because whenever a cancer or tumor is there in our body, this tumor will be producing some of the substances that is known as tumor markers. So these all are the thing considered as tumor markers. So that level, the level of these substances will be an indicative of cancers. Okay. Now, according to American Cancer Society recommendations, early detection of cancer, that recommendation is there. So, for breast cancer, females are more prone, and age of 20 to 39, also more than 40 must be more cautious. Evaluation must be done for as CBE and BSC, that is clinical breast self examination and breast self examination, and every 3 year and every month that must be done for 20 to 39 years as well as more than 40, because every month after the periods, after the 7-day period, after the onset of period, 7th day, after that day we can go for breast self examination. Okay. Now colorectal cancers, male and female are considered after the age of 50, and here rectal occult blood test as well as flexible sigmoidoscopy or colonoscopy, double contrast barium minima, that must be taken every 5 year, 10 year. The duration frequency is being given here. Then for prostate cancer, males are prone. Males are getting prostate cancer, and here more than or equal to 50, age of 50 must be caution. Prostate specific antigen and digital rectal examination must be carried out. Every year that must be done. Then cervical cancer, females are affecting more than or equal to age of 80 and above must be more caution. Then pap test must be done every year. Pelvic examination every year must be done. So basically breast cancer, colorectal, prostate cancer as well as cervical cancer, these are the most common cancers occurring in our society or community. So these four things you have to be keeping in mind always. Okay. Now let's move on to tertiary prevention. In tertiary prevention, it is used when the disease process has advanced beyond its early stages. So here, the disease have been progressed or advanced beyond its early stages. So these include all the measures available to reduce or limit the impairment and disabilities. And here we will be promoting the patient's adjustment to irremediable conditions. So basically, it include after in the later stages of the disease, the patient will be in a disease state only. There we will be controlling the symptoms, and we will be provide some kind of what to say, um, limiting their problems and promoting their comfort, etc. So basically these interventions include disability limitation and rehabilitation. Okay. So here one thing we have to keep in mind, this here already the disease have advanced beyond the early stages. So we have to give that kind of care to such patients, that included in the tertiary prevention, and together we can call it as disability limitation and rehabilitation. Okay.